Hey everyone, welcome to This Explainer. I am genuinely so excited to have you here today because we are unpacking something that is actively, literally reshaping the very foundation of how we experience medicine. We're looking at Canada's healthcare innovation strategy. More specifically, how the country is transforming healthcare from the ground up using artificial intelligence. And listen, this is not some far off science fiction concept. It's happening right now in hospital rooms and research labs across the country. And the results? They are nothing short of incredible.
To really understand why this matters so much, we first have to look at the massive barrier facing modern medicine today. Our brains are amazing, right? But human cognitive limits usually top out at processing about 7 things at any given time, give or take a couple. That's just how we're wired. But a complex medical decision today, that often requires analyzing a staggering 1,000 different parameters. The sheer volume of data involved in patient care completely outpaces what the human brain can naturally handle. So we have this very real, very urgent need for AI assistance just to make sense of the information we already collect. And when we actually bridge that gap with AI, the impact is absolutely profound. Here's a number that should immediately grab your attention: 26%. That is the dramatic reduction in unexpected hospital mortality achieved in a Toronto hospital simply by deploying localized AI innovations. Just let that sink in for a second. 26% fewer unexpected deaths. Okay, let's dive into exactly how they're doing this. Here is our agenda for today. First, the healthcare complexity crisis. Second, AI saving lives today. Third, why AI needs human co-creation. Fourth, Canada's national AI strategy. And finally, scaling health innovations nationwide. All right, starting with part one, the healthcare complexity crisis. At its core, this is a deeply human crisis. We have incredibly dedicated, brilliant medical staff who are quite simply drowning in data. Despite the massive exponential growth in patient data, I'm talking lab results, vital signs, imaging, medical history, the average physician only has about 15 minutes a day to review a typical patient's chart. Think about that for a second. Actually, let's put it this way. You have a 1,000-piece puzzle, and you only have 15 minutes to put the whole thing together. Naturally, this leads to some really tragic blind spots. Let me share a heartbreaking example that really highlights exactly what is at stake here. Take a look at this timeline. It tracks the care of a 73-year-old retired banker who was admitted for a routine internal medicine issue. He had a standard procedure in the evening. Overnight, his vital signs were checked twice, which is completely standard protocol. But then, at 8:30 the next morning, there was a sudden drop in blood pressure and he unexpectedly passed away. The subtle, invisible early warning signs were hidden deep in the data overnight, and without continuous comprehensive monitoring, they just slipped through the cracks. It's devastating, and about half of the unexpected deteriorations in internal medicine happen exactly like this. Which brings us to part two, AI saving lives today. So how do we catch these invisible warning signs before it's too late? Well, frontline heroes in Toronto hospitals are fighting back using machine learning. Enter ChartWatch. This is an AI early warning system that's currently running at St. Michael's Hospital. And the beauty of ChartWatch is that it doesn't sleep, it doesn't get tired or distracted. Every single hour, on the hour, it's crunching over 100 different patient parameters. If it spots a dangerous trend forming, it actually pages the doctors hours before a patient crashes. It categorizes their risk and prompts an immediate bedside assessment. And this perfectly illustrates the real-world outcome. When you look at unexpected mortality rates before and after ChartWatch was implemented, you can clearly see that 26% reduction we talked about earlier. What makes this even more remarkable is that this massive drop happened during the peak stress and chaos of the COVID-19 pandemic. The AI stepped in and provided an essential safety net when the human system was under absolutely unprecedented strain. And, it's not just internal medicine. Take radiology, for example. By using AI to analyze head CT scans, they've reduced diagnostic wait times for brain bleeds by an astonishing 70%. What used to take 3 to 4 hours for a radiologist to spot, prioritize, and triage is now flagged by an algorithm in just 1 minute. 1 minute. That is time that directly, literally translates to saved brain tissue and saved lives. All right, let's move on to part three, why AI needs human co-creation. Because here's the thing, deploying these models isn't just about the math. It absolutely requires deep, intentional collaboration with the medical staff who actually have to use them. Listen to this quote. This is absolute rubbish. That was the genuine, unfiltered reaction from emergency department nurses when a data science team proudly presented them with a highly accurate AI model designed to predict patient volumes. So what was the problem? Well, the data scientists built it in a vacuum. The model gave predictions at the wrong times, it featured over 100 confusing data points, and it completely failed to fit into the frantic minute-to-minute workflow of a real ER. It was mathematically brilliant for sure, but practically useless. So they realized they had to pivot. They shifted to a co-creation model, and this was a real game changer. Step 1, they actually engaged the frontline users directly and had them dictate the requirements. Step 2, they ruthlessly cut the output from 100 data points down to just the 9 most essential metrics the nurses asked for. And step 3, they brought in human factors design experts to build a streamlined, color-coded dashboard that a nurse could read and understand in a split second. The takeaway here? AI only succeeds when brilliant algorithms meet human-centered design. Let's look at part 4, Canada's national AI strategy. So, zooming out from those incredible local miracles in Toronto, we really need to look at Canada's macro-level AI for all national strategy. The Canadian government has laid out some very distinct priority sectors for AI investment, and health and life sciences is right at the very top. It is basically the tip of the spear for this entire sovereign technology strategy, standing right alongside massive sectors like energy, agriculture, and manufacturing. The whole goal is to build sovereign resilience by keeping world-class research and application anchored right at home. And to put some real momentum behind this, there is a dedicated $200 million commitment specifically for an AI healthcare mission. $200 million. The primary targets for that funding? Reducing those agonizing emergency room wait times, easing the massive administrative burden that burns out clinicians, and fundamentally improving patient outcomes from coast to coast. Now, this broader national strategy rests on 6 core pillars. It's a very comprehensive framework. On one side, you have Pillar 1, which focuses heavily on strict safety safeguards to protect citizens, while Pillar 2 is all about empowering them through digital literacy. Then on the other side, Pillars 3 through 6 are all geared toward rapid technological adoption, building a sovereign AI foundation, scaling domestic tech champions, and forging global alliances. It's a really carefully structured balancing act between ensuring public safety and aggressively pushing innovation forward. And finally, Part 5, Scaling Health Innovations Nationwide. So, the big question is, how does Canada take a massive success story like ChartWatch in Toronto and actually make it available to someone on the other side of the country? Well, first, through digital infrastructure. Backed by a $100 million investment, Vital is a pan-Canadian health data platform. You can kind of think of it as a highly secure digital bridge. Historically, hospital data has been trapped in these isolated institutional silos. Vital safely unlocks and connects that clinical data across multiple provinces, which provides the massive, diverse datasets you absolutely need to train the next generation of AI healthcare models. But data is only half the battle. Then there is the human infrastructure. That's where CHICARM comes in, the Temerty Center for AI Research in Education and Medicine based at the University of Toronto. It's a massive talent network spanning over 30 institutions across Canada. It basically acts as the critical connective tissue, bringing together the computer scientists who build the models and the frontline doctors who actually need to use them, making sure everybody is speaking the same language. And finally, we are seeing massive investments in physical infrastructure. The University Health Network's new surgical tower at Toronto Western Hospital is a prime example of this strategy in action. This new facility is going to feature over 20 advanced operating rooms equipped with Da Vinci robotics that actually use real-time AI navigation to guide surgeons. They also have a dedicated UHN-AI hub that's actively mapping out cancer progression and building predictive drug models. Guys, this is the future of medicine being built out in brick, mortar, and code. All right, as we wrap up this explainer, I want to leave you with a question to chew on. What does a sovereign, fully integrated AI healthcare system look like for the future of your family's care? Because we are rapidly moving past the days of doctors relying solely on their memories and paper charts. We are entering an era where the immense analytical power of artificial intelligence seamlessly combines with the irreplaceable empathy and judgment of human doctors. It is a future where hidden warning signs are caught, wait times are slashed, and the focus returns exactly to where it belongs, the patient. Thank you so much for joining me to explore this fascinating shift, and I really encourage you to keep your eyes peeled as these innovations continue to evolve.